Hair transplantation surgery is a calling. We are an eclectic group of doctors who have gravitated toward the surgical management of hair loss. I don't know of any other procedure performed by so many different specialists. Other procedures like breast augmentation, facelifts, and nose jobs are almost exclusively performed by plastic surgeons. Babies are delivered by obstetricians. Cataracts are removed by ophthalmologists. Hips are replaced by orthopedists. But hair restoration surgery is performed by physicians who initially specialized in a wide variety of fields, including dermatology, plastic surgery, urology, family medicine, ENT surgery, emergency medicine, more. It's like in the movie Close Encounters of the Third Kind, where Richard Dreyfuss and multiple other characters are inexorably drawn to Devil's Tower. They cannot resist its pull. My first exposure to hair transplantation was during my dermatology residency, where I was taught the old plug technique. I thought it was barbaric, but I felt the calling and read articles and taught myself newer techniques, and then spent a full year in an advanced fellowship training program so that I could master the procedure. And that's how I joined this group of diverse experts who, over the past 25 years, brought hair transplantation from the dark ages of plugs into today's world of incredible aesthetic results using either strip or FUE harvesting methods and advanced hairline designs. It's been an amazing journey for those of us who fought so hard at the beginning to make things better. So it is very frustrating when doctors who have not experienced that calling choose to perform hair transplantation purely as a way to make money, and do so in sloppy and unethical ways. Many of these doctors have no training in hair surgery, but they buy a machine and then delegate critical surgical steps to unlicensed individuals. The most important guiding principle of medicine is primum non nocere, which means first, do no harm. Delegating surgery inappropriately is doing harm, and these individuals do not deserve to be called physicians. Imagine if an obstetrician, instead of delivering a baby, went to have a cup of coffee and had the receptionist deliver the baby. Not an NP or a PA or an RN, but someone without a license. What kind of doctor would do that? Yes, patients can protect themselves, but they need to know what questions to ask and not be afraid of asking. When it comes to harvesting FUE grafts, the patient should ask the doctor if he or she will personally be harvesting every graft, not supervising, not involved. Two of the terms these doctors use to avoid telling the truth, but harvesting. And if the doctor evades that question or tries to explain that it's okay if someone else does the harvesting, be polite, smile, say thank you, then get up and walk away from that office. There are so many surgeons who do it right that if patients take the time to do the research, they will find one of the ethical, competent doctors. A good place to start is the ISHRS website. If your doctor is a member, and ideally a fellow member, it's very unlikely that they delegate, and very likely that they have the calling.